As requested that I explain a little bit more about carpal tunnel syndrome. Carpal tunnel syndrome is a condition that the patient's feeling tingling, numbness, pain, and sometimes the weakness of the lateral fingers of the hand. Typically, the finger number one, the thumb, finger number two, the index, and the third finger. Um, to be able to understand this disease, we need to understand the structure of the nerves distributing through the fingers. There are two major nerves going through the palmar area. One nerve is supplying the lateral side of the hand. It's just going to the exactly midpoint of the hand, and then is giving one branch to the thumb, to both sides of the thumb, one branch to both sides of the index, and then one branch to both sides of the third finger, and then one branch to the lateral side of the fourth finger. So technically, it's supplying the first, second, third fingers and half of the fourth finger. This nerve is called median nerve. The reason we call this nerve median nerve because the point that is passing through the hand is exactly in the midpoint of the hand. That's why we call it median means middle. It's different than medial ending with L. The other nerve, which is responsible for supplying the fingers, which technically remaining 1.5 fingers, it's called ulnar nerve. And the ulnar nerve is from the medial side of the hand. It's going to the medial side of the fourth finger, and then both sides of the last finger, finger number 5. There is a cover in the carpal area or in the wrist area here. There is a little cover covering the median nerve. If you want to know the medical term for this cover, it's called the flexor retinaculum. This flexor retinaculum, along with the median nerve, is covering a couple of other ligament that go into the hand. The thing is, under this ligament, there is a little passageway, which we call it carpal tunnel, which median nerve and the tendons passing through under this. When you start using your wrist for a long time, repeatedly, I'm talking about 20, 30 years, this little cover or flexor retinaculum slowly becomes thick and fibrotic. When it becomes thick, hard, and fibrotic, slowly compresses on the median nerve, especially when you're holding your hand in 90-degree flexion or 90-degree extension. The thing happens is we have to understand any time there is a nerve at some point is under compression, from that point to the end, or we call it to the distal, the client start feeling some symptoms such as tingling, numbness, and sometimes shooting pain towards the end of the nerve. When this condition becomes longer, usually because the nerve supply to the muscles will be also impaired, the muscles will start becoming weak. So in the later stages of carpal tunnel syndrome, we will see the weakness of muscles of the thumb and muscles of these two fingers mostly. So the finger number 2 and finger number 3. That's why the gripping power of these clients becomes weaker. If you hold a pen in their hand and you try to pull the pen from their hand, they cannot hold it strongly. So the carpal tunnel syndrome, as you can see, it takes time to get developed. You have to be like a middle age or older person who's using your hands a lot, which then you develop this thickness of this little cover that compresses on the median nerve. By massage, we can do some techniques over this flexor retinaculum to release the compression from the nerve if it's the early stages of this disease. But if it's later stage and this thickness is too much, sometimes massage really doesn't help, and the only solution would be surgery. The other thing I have to add is these patients usually complaining that tingling and numbness or pain starts in the middle of the night. They are sleeping and suddenly they wake up. The fingers, the first and second and third and a little bit fourth finger is so numb and painful. It takes a while until the pain gets better, the tingling goes away, and then they go back to bed. The reason of this sign is or symptom is because they're sleeping. They don't notice that they bend their hand, they flex it in a not in a neutral position, and the compression on the nerve slowly increases. When they are up, they're gonna feel that numbness right away, and they will change the position of the wrist and they release the compression. But when they're sleeping, they don't notice it. This compression on the nerve increases and increases. The tingling gets worse, more and more and more, until it goes to the point that wakes them up from the sleep. That's why one of the solutions for these patients is when they sleep, there are some wrist bands or gloves which has a little small piece of metal inside of it that holds the wrist in a neutral position. They always recommend them to wear one of those gloves before they sleep, and they will not have this sign during the sleep. Thank you.